Hello and welcome to the Discover History YouTube channel, and today we're doing part 2 of our medieval look at surgery. Now this is really a video for Miss Withers, however this is available for everyone, and as we always say, please give us more suggestions. You can contact us via email, you can message us on here, or even on Facebook, Twitter and Instagram. Let us know what you want to see. At the moment we've got a little list forming and we're going to do those over the next few weeks and months, but keep sending them in. So Miss Withers, this is part 2 of our look at medieval surgery. Now before we show you a surgical technique like we did yesterday with removing an arrow, I'd just like to go into a bit more detail about who the surgeon was. Now the surgeon was literally someone that did operations like they are today basically. The interesting thing is how they used to spell surgeon. It's not as you would spell it today, for example, something you might want to look up. But the surgeon was the person that did full-on operations on people, and as I said, they were trained to a certain degree. They did an apprenticeship as well, so they were a surgeon's assistant for a long period of time. And by the 15th century, as I mentioned, they became known as barber surgeons, and the reason for that is what they decided to do. The medieval guilds were grouping together different organisations in trades, and when they looked at the barber who used to shave people and cut hair, because they noticed that they used things like a razor and used things like scissors, they thought, well, because they're using sharp implements, then surely they should be grouped together along with the surgeons who use things like saws and knives. So what they ended up doing is grouping those together as one. And it's interesting because long ago, even before the 15th century, most people knew where the surgeon lived. So he would live in a house and everyone knew that he lived down the lane, for example, first on the left. But with the Barber Surgeons Guild being formed, they actually took on using a red and white pole. Now this is a basic one, and this is something that we use. We hang it on our tent when we're doing events, but a lot of houses that had a barber surgeon living at it started having these hanging up or stuck on the side of their house. And the red and white pole was chosen because the red is obviously the bloodletting, really. White is often referred to as bandages, but it also refers to the miscellaneous items as well, really. The things such as the hair cutting and the shaving a person. So years ago, in an age where not many people could read or write, it was so important to have visual aids. So if you ever see a red and white pole, it means that you can have a haircut and maybe have your leg removed. It's funny because if you wander around a town or city today, you will find red and white poles still being used by barbers. But luckily, they don't cut your leg off anymore, as far as I'm aware. So the barber surgeon, by the 15th century, was the man that did all the operations, and like I said, they worked from home usually. Operations weren't done in an operating theatre. There was a lot of infection. Operations could be done at a person's home, or you would come into the house of the surgeon and he would have a chair for you to sit in. No one was laid flat out in the Middle Ages. Operations right up to the 18th and early 19th century was done in the seated position, in which case you have your assistant, who will later on become a surgeon as well, who would hold the patient down in the chair, and he needed to do that with a lot of strength, because obviously this is an age where there is, as I said before, no anaesthetic whatsoever. So the surgeon, the barber surgeon, would cut people's hair. That was one of his jobs, really. He would shave a person, because that was also a skilled job using a blade. He would also bloodlet, and in certain cases open, for example, swellings up in pustules and things like that. It would slice into them and lance them. A horrible and disgusting job. They could also use something like this, which could be inserted into what can I say, really, your bottom or anywhere else, to be fair, and that was used literally not as a syringe to inject something, but it was used to flush parts of the body out is the best way of putting it, really. And obviously the barber surgeon, in an age before dentists, also did dentistry. So you could go to the barber surgeon's house in the 15th century, marked by the red and white pole, and you could have a tooth removed, a leg removed, you could have all sorts of body parts washed out, a haircut and a shave all under one, really. They were multi-skilled people. Now, operations, surgical procedures. As I mentioned, in the video we did yesterday, we looked at arrow wounds, but that's only one type of wound. There are lots of other problems with living in the past. Knights, medieval foot soldiers, even your average person working or walking in the street could end up with a bad head injury. Now, head injuries could be treated with things such as willow bark, for example. It eases pain, for example, or the patient may be asked just to sit down and rest for a while. However, sometimes if a patient gets really bad head pain, it could be an indicator that there's bleeding going on inside the skull. Now, the skull is a container and there's no exit or entry point in it. So if there is swelling, or more importantly, bleeding inside the brain, the skull will actually fill up with blood, and it will basically stop the brain functioning. So what they used to do in the Middle Ages is something known as trepanning. And if you look at an earlier video, I looked at trepanning through history from the Stone Age up to the modern day. So in the medieval period, if you need to trepan someone, the first thing you need is a fleam, a fine knife, very much like the scalpels are today. Not really that clean. They would have just been washed in a bit of water, if that. If you've got a busy surgeon, he may be letting someone out the back door that's just had a boil lanced, for example, and then he's going to use this straight on you automatically straight after, not even washing it. It was a dirty old age. Now, this knife was used really to cut the skin away on the skull, because what we're going to have to do is drill a hole to let that blood out, because like I said, the skull is a container with no openings on it, really. So this knife will be used to deflesh the skull. I always say X marks the spot. Put it onto the skull, peel back the skin. And then they would take this. This is a trepan. This is a medieval trepan. This would be used as the drill. This is going to drill the hole through the head. So this now goes onto the skull, onto the hole, onto the bone that you've actually cleared of skin. And the reason why it's blunt at the top is you can press all your weight of your chest on it, and then using both hands, you start drilling a little hole in the skull. And what they often used to do is drill a circle of little holes, and then the bone can be removed and the blood will be expelled from the skull. And then all you will do then is place the skull back in place, or maybe even a hammered silver coin, and then the person will be bandaged up, sewn up, bandaged up, and sent home, and hopefully survive. Most people died of infection, but saying that, we have archaeological remains showing this operation where the bone has regrown, which tells us the patient did not die but lived afterwards. So it's quite an exciting and amazing thing. But then there is also dealing with cuts. Very common in the Middle Ages, not just because there was a lot of fighting, so this is not just military, but this could be, for example, cutting yourself on a knife whilst cutting meat, or cutting string, or cutting yourself on an axe. Well, if that happens, the surgeon will try and control the bleeding using small bags full of moss. These will be bandaged tightly onto wounds to hopefully stop the bleeding. They may even take a needle and thread, run the thread through the beeswax, was quite a common thing. It waterproofs the thread, and then sew up the wound depending on how severe it is. But in some cases, more so in battle than anything, the wounds, the knife cuts, the incised wounds could be pretty horrific, in which case they will treat it using a cauterizing iron, We looked at these when we were talking about arrow wounds on Wednesday. So this will go into the fire, get extremely hot, and when you're sure this thing is hot enough, that would then be plunged into the sword cut or wound, and because of its shape it allows you to seal those veins and arteries quickly, but it caused intense pain. Now the problem with using cauterizing irons, be it one for arrow wounds or for knife wounds, is down to the fact that by using these things you can kill flesh. It's quite a common thing, and if you kill flesh, it doesn't have a blood supply, it will basically die off. So cauterizing can often make the patient worse. It's a very, very difficult situation living in the Middle Ages, really. They're going to die anyway. Can you help them? Yes, but it may make them worse. It may keep them alive for a week, 2 weeks. That's the balance that you have to make, really. So medieval surgeons were trained people. We often think of them as just these mad people that went around cutting arms and legs off. They were trained. They were apprentices. They would have learnt the trade with another surgeon in a hope that one day they would set up their own surgery. But remember, they didn't have an operating theatre. They didn't really have hospitals in the Middle Ages. There were hospitals, but they were mainly run by monks, and they were really places for the elderly more than anything, the elderly and the infirm. And surgeons would often operate in their own home or in people's homes. By the 15th century, remember, they have this guild of barber surgeons, allowing them this red and white pole, this red and white symbol of their trade. And as I mentioned, haircuts, shaving a person, removing teeth, washing them out. They did lots and lots of jobs. Extracting arrows in war, dealing with wounds, and dealing with head injury. They are multi-talented. Now tomorrow we'll do another medieval surgical procedure in our video, and I like to call it the full Monty, purely because tomorrow, and I've left it till tomorrow, I'll do a video purely on the amputation of fingers and toes, the amputation of an arm or a leg, for example. What was always referred to as the trickiest and hardest of all operations. It's the operations that is likely to kill a person. But saying that, in archaeology we do see where the bone has regrown. So in some cases patients do survive if they're fortunate enough not to get infection. So living in the Middle Ages was dangerous. We are so glad we live in 2020 when we have got anaesthetic, we've got cleanliness, and we've got an amazing team called the NHS, which we all clap on a Thursday night. Anyway, stay in, enjoy yourself, take in the lovely weather, and we'll see you tomorrow for yet another medieval surgical procedure. Bye bye.